let's show you some, a graphic for that matter, of a joint being replaced and why you may need it. So can no longer complete daily tasks without help. The pain keeps you up at night. Your pain isn't relieved by non-surgical approaches. Your pain is wearing you down physically, emotionally, and mentally. You're suffering severe side effects from your medications. Tests show significant joint damage. These are all reasons, doctor, where you say, aha, okay, maybe it's time.
Yeah. Yeah, absolutely. Like I said, and we kind of touched on with the knee, we'll see all these things, or some of these things, in patients with hip arthritis. And the reality is, I have patients that come in my office, they say, someone told me I need a joint replacement. Well, the reality is it's elective surgery, okay? Nobody needs this to survive. It's not your heart, it's not your lungs, you know, it's your hip, which is very important. But at the same time, no one should ever feel pressured to have this surgery. But what you should understand is that it's an option. We can do it with great success. If we look at outcomes from hip replacement, we're dealing with about 98% success in this arena. And it's there for you if you get to a point where you're having more difficult days than good days, and if your scope of experience or your lifestyle has changed because of your hip. Don't let that happen.